This is the HeadRush Podcast with Paul Fraze and Corey Berry.
Paul Fraze here with the HeadRush Podcast. You all know my co-host Corey Berry. In this episode, you're going to actually experience Corey at kind of his worst. You're going to experience him getting overstimulated, and he goes into a stage of flooding, basically. And interestingly, on this episode, we actually have three of Corey's caregivers, and they're going to show you how to get Corey, how they work with Corey when he is in this state of mind, and brings him back to baseline and to where he can function. So tune in, like, share, subscribe. We'll see you soon.
Welcome to the HeadRush Podcast. I'm Paul Fraze, and I played 11 years in the NFL, and our co-host, Corey Berry, rode professional rodeo for 9 years. Corey, tip of the hat, or at the HeadRush Podcast, we talk about everything related to trauma, to brain trauma and brain health and wellness. We talk about traumatic brain injury, TBI, chronic traumatic encephalopathy, CTE. We talk about traumatic encephalopathy syndrome, TES, repeated head impacts, RHI, and we cover how traumatic brain injuries can and will cause mental health issues such as depression, addiction, lack of executive function, memory loss, even suicide ideation, as well as degenerative neurological issues. These symptoms can all be found on the Mayo Clinic and Boston University websites under symptoms of CTE. Our mantra is how to cope and find hope, and we focus our energy on finding therapies and sharing hope through education and by raising awareness.
Good job.
I didn't stumble on chronic traumatic encephalopathy. I don't think. I may have.
I'll give you 3 stars. Today's going to be a special day. We got a great neurologist, a great vestibular therapist, physical therapist, and a great speech pathologist. The bad thing about all 3 of them is they all take care of me. So this episode is going to be beat on the cowboy day. We're going to talk about my symptoms. We're going to talk about my therapies. We're going to talk about autonomics, vestibular. We're going to talk about a whole slew of things. But it's beat on Corey Day. And talk about
Let's get started.
brain.
Yeah, let's get started.
Let's get started.
First, we have Dr. Kaytser, and you're actually, we talk about it, you're our resident neurologist.
And psychiatrist.
And psychiatrist, doctor of psychiatry as well. Anyway, Dr. Victor Kaytser is a faculty associate in the Department of Neurology at UT Southwestern Medical Center. He specializes in general neurology, headache medicine, concussion, and sports neurology. He is certified by the American Board of Psychiatry and Neurology, and he joined the UT Southwestern faculty in 2022. He's a member of the American Headache Society and the American Headache Society. Mm-hmm. And the American Academy of Neurology. Welcome, Dr. Kaytser.
Yes, thank you so much.
I really appreciate you being back on. We also have as our guest Samantha Johnson, and she's the owner and the supervising doctor of physical therapy, of mind-body balance physical therapy. Samantha has been working with Corey in the field of vestibular therapy, which I had no idea what it was when we first met about a year ago, maybe. And we will take a deep dive into how this type of therapy can help with TBI. So thank you for being here, Samantha. And we also have Kristi Ferguson. Kristi is a speech language pathologist. She said she can help me out tremendously, especially I usually trip out over a bunch of words. I'm probably tripping over a bunch of words.
You already have.
All right. So shut up and just do the introduction. Okay. All right. So Kristi is a speech language pathologist specializing in traumatic brain injury with a focus on post-concussion syndrome, She earned her master's in communication disorders from the University of Texas at Dallas in 2001. Kristi is the speech therapist for the outpatient concussion therapy program at Texas Health Resources Fort Worth Hospital. She also works with the college rehab, helping patients with brain injuries return to their lives post TBI. In 2019, she founded the Dallas-Fort Worth Concussion Support Group.
And just left there to come to this podcast.
Thank
We
you
had
very
a
much.
support group this morning.
Well, we should have been there too. Now, this is kind of a bummer, but it actually gave you a lot more insight.
Gave her street cred.
In 2021, give her street cred. In 2021, Kristi gained a deeper understanding of her patient's challenges when she became a brain patient herself, undergoing surgery for an acoustic neuroma, which is a benign brain tumor, and subsequent bacterial meningitis. So this profound experience has not only deepened her empathy, but also provided invaluable insights, making her an even more effective clinician. So thank you very much.
Thank you for having me.
Awesome. Well, let's get started. This question is for all three of you. What is wrong with Corey Berry? Who first saw Corey?
Kaytser.
Dr. Kaytser. When he came to you 2 years ago, a year and a half ago?
Yeah, probably.
What did you find sitting in your examination room? I know he has been. Tell me again. 1999.
Right.
You were actually diagnosed with.
Hold on a second.
Okay.
Keep going.
All right.
In 1999, I was diagnosed with cognitive nerve damage and a broken neck.
Okay. And why? And you had been doing professional rodeo for
9 years.
9 years. Okay.
But I rodeoed before professional also.
Sure. You said you got on your first bull or calf or whatever you guys ride.
I think I got on my first calf when I was. Damn it.
Do you need this or?
No.
Okay.
Stop a second, Jordan.
Did you knock out your hearing? I think we'll probably just get into some of the therapies.
So, I think I got on my first calf. I think I was 5.
Oh my gosh.
When I got on my first calf, and I rode off and on all the way up through going. I think I got on my first sheep when I was even younger.
Mm-hmm.
In mutton busting. But in 99, I got diagnosed with cognitive nerve damage from University of California, San Francisco, neurology department there, and a broken neck. And Dr. Tandy Freeman over the phone pretty much told me that, are you going to the NFRs? Are you going to the circuit finals? Are you going to IPRA series circuit finals, local circuit finals? Are you doing? And I said, no. And he says, well, don't you think it's time to quit? And the neurologist looked at my wife and told me and her both that if I got bucked off, I had a 50-50 shot of living or paralyzed. If I hit my head the right way, I could die immediately. So that ended my rodeo career, and then I've had trouble mounting ever since. But I got my first in 2014. Dr. Sanchez said that a year ago we wouldn't have been able to diagnose you. It's due to all the NFL testing and everything. You got repeated head damage from all the concussions and hits to your head. And then in 2019, on my neurological exam here in Dallas, it was written for the first time on a piece of paper, suspected CTE.
And that was 2019?
And then in 2024, and I already knew Kaytser, but I was already sent by Boston University to Jeremy Tanner. I just ain't seen him yet. And I went down and saw Jeremy Tanner October of 24, and he clinically diagnosed me traumatic encephalopathy syndrome, probable CTE. Did I do good there, guys?
You did it. Great job.
You tracked it. I'm glad. Don't take this the wrong way. You're a lot smarter than I thought you were. Because when your doctor said you got a 50% chance of getting off the dirt after, I'm glad you listened to your doctor.
I listened to my wife.
Oh, she had some things to say about it?
Yeah, as if you want to write again, sign here.
Oh, so if it wasn't for Susan, you
be dead.
You probably would have wrote again. Yeah.
Oh, I guarantee you, if it wasn't for my wife, I would have never went to the doctor in the first place. I would have never known my neck was broken. Well, I had a broken neck for a year and a half and was still riding.
You were riding, yes.
And didn't know it was broken. 30 years old, creeping up, riding bucking horses. You're like, my neck's hurting. Jesus. I thought it was old age and riding. Come to find out, it was broken. And it was refusing offline, pinching my spinal cord. And I was having issues and falling back, and my eyes would roll back in my head and I'd fall. My balance would. And so I called Tanner up and said, because of my wife, I called Tanner up and said, hey, I'm having an issue. He said, give me 10 minutes. And in Tanner's 10 minutes is normally 2 hours. He called me back. He said, can you be at UCSF tomorrow morning? And I was like, yeah, 7-hour drive, but yeah. So we went down there the next morning. They did a bunch of scans, tests, all that stuff. Sent me back home. And I think it was Dr. Jorgensen. I can't remember. My wife, if she was here, she could tell you. Said, well, we got 2 things for you. But I said, what's that? Well, one, you got a broken neck. And I went, what? Baloney. I can turn my head right. I can turn my head left. It ain't broken. And the other thing is you got cognitive nerve damage of the brain from too many hits. And Tandy will be giving you a call in the next couple days. Next thing you know, I was then getting my neck fused and going to more neurological tests. And
Dr. Kaytser, when you hear neurological, what did you say? You were diagnosed with neurological
nerve damage.
Cognitive nerve damage. What does that mean?
I mean, for me, it's not necessarily a term I use all the time, but it's a broad term suggesting that there has been damage to, some of the nerve centers of the brain, like the frontal cortex, the parietal lobe, the temporal lobes, that results in a disconnect between our communication and cognition. So we see short-term memory, long-term memory, speech issues.
How do you diagnose somebody like Corey? What type of tests did they run? Is it like...
Yeah, usually we have some in-office cognitive assessments that we use. And the nice thing about those is that we can kind of ask certain questions and pinpoint which areas of cognition he seems to be struggling with the most. And that also helps us kind of localize what are the big issues, where are they located in the brain, and that may help us to kind of guide treatment strategies.
Well, this is pretty.
And he sent me to Hopewell, correct, for my neurological exam.
Yeah, Dr. Hopewell is also a doctor that he's a neuropsychologist, and so he sees a lot of patients and is able to more extensively over the course of several hours actually really dig deep and figure out which areas of the brain are not working as well as they should. We also have the ability to maybe compare to other people in the same age group or other people with confirmed Alzheimer's and see how that data compares to those populations.
Mm-hmm. Interestingly, you mentioned you would have never gone to the doctor unless it was for somebody from somebody else. In this instance, Susan, your wife,
right? Because we buck up, shut up, and get up.
Exactly. Well, so I don't know if it's a male thing or an athlete thing, but I did not go to a doctor until I had my stroke, and I knew I was in AFib for 23 years, and no, I didn't know.
Jacksonville, you found out, right?
Yeah. After, so you get to the point where, okay, you got a broken neck and you got some neurological issues. You go to see a doctor like Dr. Kaytser. What are you expecting? I mean, and what
honestly, I was expecting the runaround because I've been getting it for 26 years.
So you had gone to a couple.
Oh, I've been to some of the best neurological studies and things from 99 all the way up to Tanner and Kaytser. Alan Martin right here in Dallas, who is one of the top neurologists. And he pissed me off. He's a great neurologist. But I did a neurological exam for him in 19 and it came back suspected CTE. Dr. Martin didn't mention it. He just diagnosed me encephalopathy and didn't mention the CTE. Kaytser didn't mention CTE in our first 3 or 4 meetings. And I was already going to see Tanner, and when we started talking about CTE, he knew I was already going down there. And that's why in that one episode, he wanted me to go see Tanner to get the TES.
Well, so we want to bring awareness not only to the general population, the parents out there that are strapping the helmets on, or letting their kids bounce head the ball over and over and over again. You probably, Samantha, you played soccer in grade school.
I started soccer when I was 10, and when I started playing soccer, there were not any rules against heading the ball. I mean, as a matter of fact, if you didn't head the ball and win the ball in the air, you were pulled off the field. So,
right.
You were taught to be very aggressive. And I'll say, fortunately, in my soccer career, I played a holding midfield. I played a center midfield. So I was responsible for always being on the receiving end of punts and goal kicks and all those things. So that was my job, was to win the ball out of the air. Plus, I was tall. And I was fortunate in that I never had a head injury, but my sister played college sports with me, and she got her first concussion when she was a kid, and then she's had 6 through our college career. So less fortunate there.
No,
for sure.
Ladies and gentlemen, this episode is brought to you by Millennium Health Centers, Dr. Mark Gordon at tbihhelpnow.org. He signed on with us. You've seen him in our episode 2 with Dr. Mizell DeMeo and Dr. Gordon.
Dr. Gordon's been featured on a movie, Quiet Explosions, a documentary about TBI. Featured Andrew Marr, a Green Beret blast explosive specialist. And they talk about TBI, PTSD, traumatic brain injury. And gosh, I've watched that movie about 4 times. And I know Dr. Gordon has also been on Joe Rogan 6 times, so he has something good and powerful to say about about TBI, traumatic brain injury. So go to tbihelpnow.org.
Correct.
And make sure you get in touch with their team. Dr. Gordon also works with the military. Do you want to?
Yeah, he works with the United States military. He's done the Pentagon. He's working real close with them. If you're a veteran and you need help, go to tbihelpnow.org. Dr. Mark Gordon quit his private practice just to work with the military.
Work with veterans suffering with PTSD.
Right, PTSD, TBIs, and repeated blast impacts.
Exactly.
And if you are a veteran, there's nothing closer to my heart than the people that serve our country and protect our way of right and our way to be able to do this podcast for you. So go to tbihelpnow.org and get the help you need. Mark Gordon, we work with him on the Brainwell program through Mizell DeMayo. If you go to tbihelpnow.org, there's a list. There may be a provider in your area in Canada. He's all over. So go to tbihelpnow.org and check it out.
So you were understanding more of what you were going through, and then you go to Dr. Kaytser. He doesn't pinpoint any CTE issues, but he knows you're going and you're exploring that avenue.
Right. Well, I think he knew it. He just wasn't. He was waiting for Tanner.
Well, what do you think? When you see Corey coming in. And by the way, have any of these pissed you off before?
All 3 of them.
So you're not special. So don't worry about. Well, how do you work with somebody like Corey coming in and?
Yeah, so Corey, like a lot of other athletes or people who've had traumatic brain injuries, you get that history that there's been repetitive head trauma over many years, and then now all of a sudden having, or maybe not all of a sudden, but gradually developing a variety of symptoms that includes, headaches, dizziness, mood changes, sleep changes, autonomic issues, and so for a lot of physicians seeing this, you're like, okay, whoa, slow down. There's all these things that we have to try to address. And I think at an initial visit, one of my goals is to, try to gather all this history, and then also do some of the basic workup, like an MRI, blood work, see what the brain structurally looks like, see if there's maybe something missing, there's vitamin deficiencies like B12, which can mimic a lot of neurological issues that can be easily reversible. But then as we start to break things down, we see like, okay, you have headaches and they meet criteria for migraine. We have some good treatments for migraine. And there is also a lot of overlap between migraine and mood disorders and vestibular disorders. And so we can target that and see kind of what gets better, what doesn't. I think patients like to have a label. They like to know what their diagnosis is and what direction we're going into. And I think with CTE, it's hard because we don't have an objective, agreeable test to diagnose people in the living. And yet, once you throw that out there, you're basically committing them to a lifelong degenerative process that has no treatment, no cure. And so, I don't know, I think as providers, we try to just be careful that we're not overstepping that line.
And I think that's what every doctor did until Tanner and Kaytser, is that they danced around it, that they wouldn't give me a definitive and just say cognitive nerve damage, which you just heard Kaytser say is a wide spectrum of issues.
And doing the thing you did for 30, 25 years, not just 9 years, you were
right.
Really?
Well,
Of course.
and then you're talking about the fighting I got in. You're talking about boxing and karate and wrestling in high school and football in school. And
you're the type
baseball.
you're the type to do it full bore, full blast. Give it to me all. You're gonna hit me in the head. You better hit hard because I'm gonna get you back.
You better make damn sure I'm out because you ain't gonna want to see what happens when I get up.
Who was next in line in these three? Kristi. So did you refer?
She got the rap.
Did you refer Kristi, or how does that?
Yeah, I mean, there's only so much as clinicians we can do. Our biggest focus tends to be medication targets. How can we manipulate some of these hormones and neurotransmitters to get the best out of patients? But there's also a lot that we have to manipulate with the way the brain functions. And for a lot of that, it's, therapies that help to kind of re-strengthen those connections. And so that's where we need a team of people to kind of help get patients like this to where they need to be.
Mm-hmm. So how did this relationship not dissolve but evolve?
Well, now she's a friend of mine. I no longer see her because I went through the program and then switching insurances. I mean, I probably wish I could go see her, but because of medical and money. But when I went and saw her, I did vestibular, physical, vision, and you.
Mm-hmm.
And you were cognitive behavioral and speech, right?
So mainly just cognitive linguistic.
Okay.
So cognitive and language.
Tell us about that. Tell us about a typical,
Day with Corey.
Corey comes in, he's pissed off at the world.
So patients are usually referred to us by their neurologist or by another doctor. So the patients will come in. First, we get a good history. So I always ask my patients, how many concussions have you had? It's very atypical for me to see a patient and this is their first concussion.
How long have you asked that question? I mean, is what you deal with caused by concussions? So you're on the lookout for that immediately? Okay.
Absolutely.
Well, it's a concussion protocol.
Like a TBI concussion protocol. Okay.
Yes, we have a team. So most of my patients come in and this is not their first concussion. So I get a good history, talking back to when they were young. Like he was saying, when he was young, he had his first one. Look into any motor vehicle accidents, sports injuries. How long did you play the sport you're in? How much contact did you had? How many repeat head injuries have you had? And then in Corey's case, I think the catalyst was he was in a car accident. And that was what kind of threw him over. And
that was 2022?
Mm-hmm.
Okay.
And led to some increased in the cognitive linguistic challenges. So the patients will come in, I do an evaluation, we do some standardized testing. Some patients will come in and would have already had a neuropsych evaluation, so then we can use that. Some have a baseline, some don't. So we use our testing just to get an idea of where they are with memory, attention, problem solving, language skills, reading, writing. So we're looking at that whole picture. And then we come up with a plan for therapy. So in Corey's case, there was quite a lot of brain flooding. So we had to keep the environment very calm, very quiet, very dim.
So brain flooding, like just overloading or?
It's overstimulation of the brain. And the brain just sometimes...
And that causes...
Shutdown. And causes frustration, rage,
no.
tears. Yes, there's a lot of different symptoms that come from brain flooding. So that's a big part of the therapy I do as well, is educating on that.
Do you know when you were in a brain flooding situation? And do you know what you felt like? What does that feel like?
No, a lot of times if I flood severely, I don't remember it. But like right now, I'm flooding. That's why we stopped earlier, is I deep breathe, try to reel in as much as I can to do this episode. But no, when I have my bad ones, and Kristi was part of a couple of them, I don't remember them. And maybe you can elaborate on that.
Mm-hmm. And I think when you're going through that brain flooding episode, your brain just shuts down and you're not able to hold on to those memories. And so that's probably what you're experiencing, is you're just not able to form and hold on to memories during that time.
What kind of things did you do for therapy?
So I'm a very functional therapist. So when my patients come in, we talk about first, where were they before this latest concussion? What were some of the things they could do? What were some of the things that they enjoyed doing? And then we talk about, where are you now? What are the things you're struggling with? So we look at their life, like, how are you doing with medication management? How are you doing with your finances? How are you doing with managing your routines? How are you doing with communicating? And so we look at all those things, and then we come up with a good plan of care, which we target those areas. I do a lot of functional therapy, so my patients will bring in their medication. They bring in things that they're struggling with, and we problem solve together to help life be more manageable. And we do a lot of strategies, using a lot of strategies to help.
And Kristi dealt with my first back surgery also, and the anesthesia and everything with that. So she got to see what anesthesia does to people like me and you.
Mm-hmm.
And the repercussions of that. And she did a beautiful letter. And for any of you guys out there, I just remembered this. See, my memory does work.
It does work.
She did a beautiful letter when I go in to have surgery to put on the door and in my medical file, explaining that I am suspected CTE and that my memory, I could have rage. And they made sure they didn't have more than 2 people in that room at a time while I was awake. They made sure that the light stayed low, the sound stayed low. They made sure they cocooned me.
So I had, he's told me that story before, and I had an ablation and a cardioversion within the last 3 months. And when they wheeled me into the anesthesia, see the doc and the anesthesiologist, I said, hey, there's an issue here. I can, I remembered that, and I started telling, I ran down the list, and it actually helped. And they must be starting to be more aware of it as well, or they've always been aware of it, and I've never just had to say anything. But they were very, not compliant, but they were very happy to do it. And hey, you're right. We'll take care of you. One of the things, I've got a little claustrophobia, and one of the things, I had to put some in my mouth, and I'm like, no, and they let me hold it in the side of my mouth, put the anesthesia in, and when I started falling out, boom, right then they slipped it in, and but it made a difference.
Yeah, I mean, for many years too, it's a disease focus was the key. And then I remember when I was in training, the mentality was switching to, patient focus. Like, how can we make the patient more comfortable? How can we set up this room so that it's more geared toward this particular patient?
So you saw that, and you were kind of in that shift in the medical community, the medical world. That's interesting.
And then Samantha came along.
I hear she's the wild card here. Talk to me.
No, I'm the wild card.
So Samantha, vestibular therapist, doctor of therapy.
Mm-hmm.
So I really didn't know. I kind of had an idea. It's like we want to think we're smart enough to know what the word vestibular means. So it's got to mean something with something. Was it balance? Is it this? And I knew some of the problems he had, so that helped me also kind of. But explain what somebody like Corey, when he comes to you, what you see and what type of therapies and what vestibular therapy is.
Okay, so vestibular therapy, when we talk about vestibular therapy, really what we talk about is the connection between your inner ear, your brain, and your eyes. And so it's this feedback loop that basically works together. And when we talk about the vestibular organ actually sits in the inner ear. It's kind of your gyroscope. It's your internal balance center in your inner ear.
Eustachian tube?
So the eustachian tube is...
Anything, you, if it has nothing to do with it, you can say, no, that's something else. So.
Well, it can relate, but it doesn't exactly relate to this topic.
Okay.
But the way that it works is that your vestibular system in your ears constantly give feedback to your brain, particularly your brain stem, your cerebellum, and then to your eyes and your frontal cortex. And so I think, all of us probably know when somebody's had a concussion or has had a TBI or something like that, one of the first symptoms that really comes about is dizziness, having difficulty stabilizing their vision or focusing on things with their eyes. And all of that really comes back to how the brain is interpreting those signals coming in from the ear. And so in vestibular therapy, really what we work on is we work on different tactics to where the eyes start to work well again, because what we often see in a person that's had a TBI is that with all the brain inflammation and all the swelling and those signals not being received clearly, we see a lot of movement in the eyes that we call saccadic eye movement. But really what that means is that the relay center is just not sending a clear message. So we get a lot of altered eye movement. Whenever the head is moving, the eyes lose their ability to stabilize because basically that feedback loop is not sending clear signals. And so vestibular therapy is really focused around getting that part of the brain, ear-brain-eye connection to work well together again, which in turn makes you balanced again. It gives you better depth perception. It makes it so you can negotiate a step or a stair, and kind of do all of those things that you really start to lose after, especially repeated head injuries.
So Corey's therapy,
Mm-hmm.
is it consistent? Does he come in and get on a slant board and do that for 7 minutes and do another thing, or is it?
No,
It's okay.
it's not. And honestly, whenever Corey first walks in the room, I kind of have to evaluate where is his mental state right now. If he has been talking on the phone all morning or decided to go do his morning chores and has been out in the heat, he comes in and he's already kind of looking over me very glassy-eyed and already flooded, right? Which was a term that Kristi just talked about.
Mm-hmm.
And so when a patient comes in like that, the only thing that I'm going to do by asking him to do eye movement or asking him to get on a balance board is create something that we call a vestibular migraine. And basically what that means is it means that the vestibular system is basically just misfired to the brain so much, and the brain has been so overstimulated by those vestibular systems that now most of the time the patient will say they just sit there and they're just spinning, just sitting there, or they just feel like they're on a boat and it just won't stop because there's just the amount of misfiring and the excitation back to the brain is just too high.
This episode of the HeadRush Podcast is brought to you by our personal doctor and team of doctors, Dr. Mizell DeMayo, and she's with the Paradise Behavioral Health, and we are in the
Brainwell program, which is also part of the Millennium Health Center. Dr. Mark Gordon, you've seen him on Joe Rogan and even on our show, the HeadRush Podcast, and hormones. And Mizell is awesome. We love her.
She's our doctor of psychiatry. She works the Mark Gordon program with the hormones, and she adds her twist of genetics, and it basically is melding two wonderful mediums together, and we're getting great help from Dr. Mizell DeMayo.
So please check out her website at paradisebehavioral.com. Look up the Brainwell program, get involved,
She's sponsoring us. They're sponsoring us for the next year, so we are excited to have them on board and shout the good news to everybody that is watching these broadcasts. So,
is she helping you, Paul?
Absolutely,
she's helping me. So go check her out. ParadiseBehavioralHealth.com.
And what will, and instead of therapies, or what will help with the vestibular, I'm going to call it flooding, but you called it something else, overstimulation. How do you just get in a quiet room and get away from people? And
yeah, we have a quiet room, and on those days, we put him in the back, and it in Corey's case, and in a lot of cases, when patients are having vestibular migraine, they have a lot of headache type symptoms. 50% of the time, at least, they have headache type symptoms, neck pain, tension, like their jaws are just so tight. They carry all that tension and tone in their jaws. And so whenever he comes in on days like that, I personally do a lot of manual therapy. I do craniosacral therapy. I do a variety of different things, honestly, just to try to stimulate his vagal nerve and kind of just bring about that parasympathetic nervous system, like bring him down off of that like heightened state of awareness.
We were just he says he doesn't know a lot about the science, but he's the one that digs in. And he says well,
no, it's not me, it's Samantha.
Well, does she digs in and helps you talk about it?
She digs in and helps me figure it out. And you also got to realize, I also got a fused neck. I got impingements above and below my fusion now. I got arthritis in my neck. I got brain issues, back issues. I've had a back fusion. And they found central nerve. When you sent me to that vestibular test with right down the road from you, or down the alley or whatever in that hallway, they did that ear, nose, eye test, and I have central nerve damage also from the concussions and repeated head impacts.
When we heard you read something about the autonomic, and then you were reading it in her office?
No. She told me. I wasn't reading it. She told me, and then I went home and read about it.
That's what, because when we were on the phone, you were reading about it. So you had already talked to her about, okay. Yeah.
Yeah, she told me I have an autonomic dysfunction.
And that's the heartbeat and the regulatory system that we don't even think about, right?
Yeah.
Basically in the nervous system.
Your fight or flight response.
Yeah. When we think about the autonomic nervous system, the easiest way to think about it is that you have your sympathetic response, which is what Dr. Kaytser is talking about, where you have this heightened state of awareness, and then you have a parasympathetic response, which is where, vagal nerve type stuff comes in, but that's kind of your system that kind of brings you back down. And those systems are supposed to be balanced. There's supposed to be a balance between them. You're not supposed to stay in this heightened state. But a lot of times whenever we see patients that have repeat head injury, your body is in an inflammatory process. You're dealing with a lot of systemic inflammation. And so your body really stays in some of those heightened states for prolonged periods of time. And then you start to see autonomic dysfunction. And the day particularly that Corey's talking about was he came in and he had like 3 or 4 really bad days in a row. And I was like, Corey, did you hit your head again? Like, what happened? And he said, no. And so I'm drilling him with questions. And he's like, well, I was outside working and it was hot and I passed out. And so that's where we got into like autonomic control and how it's supposed to thermoregulate you and manage your body temperature, but that's not working for you anymore. And I think that's where, Kristi and I both do a good job of being like, okay, this is how you recognize the early signs of like you're overheating, and this is what this is. And this is how you avoid further almost like heat exhaustion or heat stroke events, because this system is not doing what it's supposed to for you.
Okay.
And you set alarms. You say, I'm only going to go outside. I'm going to set an alarm. I'm only going to stay out for this amount of time because my body's not going to tell me when I need to come in. And then we may not remember. And so by having that auditory cue, we'll look, oh, why is my alarm going off? Oh, I need to go inside and take a break.
And I was out moving hay, and a bundle ended up breaking, and I had to buck hay, and it probably 100 degrees outside, and I had to buck 36 bales. And when Jason showed up to help me, he found me unconscious.
Really?
Mm-hmm.
That's one thing. If people are at a certain level, so I'm not as bad as Corey, but I'm not 100%, right? But I think at my level of, where I am on the level scale, and I'm like, well, I don't think of Corey his body not being able to regulate the temperature in your body, and you question it. Okay, what happened? Really? What happened? And then you see, the issues with the autonomic system, and you were out, first of all, baling or bucking 36 bales. Mm-hmm. If I touched 36 bales in 100-degree weather, I would have been sitting down drinking water in the shade somewhere. But so I kind of get back to that. People, family members, coaches, parents, if you don't have that knowledge of what could be going on, just like the old scenario where the kid would come off the field at 7 years old, and we were talking about Tyler Sash. His father coached him, and at 8, 9 years old, he comes off the field woozy, and the father says, "Hey, we don't do that. You get back in there. If you're okay, get back in there." And we don't realize what the double concussion or the dangers of, those repeated.
The second impact syndrome.
The second impact
And
syndrome.
it's even worse than that. It's also the peer pressure.
Yeah, right.
Even Brett Favre said it best. He got his starting job because the quarterback got hurt.
Mm-hmm.
So if he got a concussion or got dinged, he didn't tell nobody because that guy could take his job.
Mm-hmm.
Mm-hmm.
Same thing in high school or in any other sport. And even in rodeo, well, we're just tough sons of bucks, and I ain't getting hauled off in an ambulance. I'm walking out.
Yeah.
We have this debate every time. Football players, rodeo.
Well, no, I'm not even going there. What I'm saying is my problem now, and I still don't get it, and maybe because my brain ain't fast enough to catch it, is I don't know. My whole life has been, you start something, you complete it. Mm-hmm. You get the job done, stay on task, do your damn job, and move forward. These people are trying to teach me, don't do your damn job. Stop after half an hour, go inside, get some water, watch a movie, enjoy life, and then come back out and do another half hour, go back in. And my brain don't work like that.
Mm-hmm.
And so when I go out and do it, my autonomic, if I remember what Samantha says, is I'm not catching that. Mm-hmm. And so I'm finding myself in issues that aren't good.
Yeah.
And I'm probably a little bit different than others because I also have the neck injuries and the nerve damage. And what is that, the CT junction that you keep telling me about that gets pinched every time I turn my head towards you, which I don't know why you're sitting there because you make me do it. But, and it hurts and it pinches off a nerve, and then that causes inflammation. And one time I guess it was completely pinched.
Yeah, one evening it was probably like 6:30 in the evening, and his wife calls me and go, Corey's not well. Can we come in?
Didn't he get a call later that night?
He came into the equation also. Yes.
Yep, I got a call
Myself.
late that night.
Yeah. And he pinched a nerve in his neck because he decided he was going to sleep on the couch or take a nap on the couch, and just, how when even we wake up with a crick in our neck, and he pinched off that nerve on that side, and he came in a flooded, we'll call it just probably the most flooded I've ever seen Corey. He couldn't focus. He couldn't think. He couldn't remember. He had even been up to the clinic earlier that day because his wife was like, can you see him now? And I was like, he will empty my clinic in 2 seconds if I let him in right now. Bring him back after hours. And so, it was the most flooded I had ever seen him. And we had a conversation about how, even that amount of pain and any damage now at all to his central nervous system, and that includes the spinal cord, causes all this inflammation and all these dysautonomia kick up, and then we're in the spot. So I worked on him the best I could that day, got him loosened up, and then we called Dr. Kaytser, which I'm so glad he was happy to receive a 8:00 at night call.
Yeah, of course.
But he was able to prescribe him some medication to get down some of that neurological inflammation and get him comfortable and resting and bring down that response. And within a couple of days, he was back in the clinic, and I would say he was probably 75% better, which was great turnaround time for what was going on.
Do you, Corey, do you remember, let me move over here. Do you remember, so Dr. Kaytser gave you some things to help with the inflammation? And
Steroid pack and muscle relaxer.
Yeah, we tried a steroid pack and a muscle relaxer, and steroids are kind of a cure-all, but you don't want to be on them long-term. And you also have to be very careful because they can sometimes worsen autonomic symptoms. They can worsen insomnia or anxiety. And so, but this seemed to be like an acute inflammatory, and I felt like we needed to hit it really hard early on to try to get him to recover faster.
And obviously heat stroke or being outside, your system's not working normally anyway, and you're out in the 100-degree weather after working hard.
Yeah.
And you didn't tell me that he found you unconscious. You didn't tell me that.
Yeah.
And I think too, when you have a patient like Corey, I mean, when somebody comes into your office like that, your option then, because I can't prescribe medication,
right.
So my option then would have been, send Corey to the ER. And
They would.
And you don't want to do that with me.
Yeah.
They would have no idea how to.
Yeah. So we really are very fortunate to have the team we have, because you send a patient like Corey with as much as going on with him, who, when he's in that state, cannot verbalize what is going on with him, can't articulate that. And you send somebody like that to the ER, just waiting in the waiting room.
Yes. The amount of flooding that comes from the emergency room is
Didn't you send me to the ER once?
possibly.
And I AMA'd myself out?
I think I went with you. I think we didn't have any other options at that point.
And I AMA'd out because I was about ready to kill people.
Which is what a lot of people do. You may not have someone trained to treat your particular condition.
Yeah.
You don't know what's going on in the ER. There may be an emergency or other more life-threatening things going on. So you end up waiting in the waiting room. There's so many lights. There's so many sounds.
Yes.
And then a lot of people end up leaving AMA or against medical advice.
Yeah.
And I am so thankful. It's taken from 99 to 24, but my team now, Crystal Mizell, who's not here. Mizell's been our podcast. Crystal, we got to get on. And these three right here keep me going on a regular basis. It's 8:00 at night, they get a phone call from my wife. phone calls, and someone like Sam who's busy, you see your first patient, what, 7, your last at 6?
Yeah.
And then all of a sudden, Susan calls and says, well, Corey needs work done. Well, have him here at 6 and works on me until 8. I mean, it's Kristi, I don't know how many times my wife has called you. And it's so bad because, and I'm going to say it, I hate Kaytser's pre-appointment thing that you got to enter on depression and all of this. But the one thing I hate is, have you hit your head since the last time I've seen you? I've been seeing you, what, 2 years now? How many times have I answered no?
Probably all of them.
No, maybe one.
Yeah.
So you hit your head.
Oh, I trip over a mat, and because my balance ain't good, I hit my head into a stall. Or that one time I was standing and I just started shaking so much I fell down.
That's interesting because we were talking. Does everybody watch Quiet Explosions? So we were talking to Andrew Marr today.
Wow.
He lives
Just north of Houston.
just north of Houston. He grew up in not Flower Mound, but Grapevine. And I talked to him a couple times through the years after watching that movie, and I asked him, I said, how is your treatment going? Because he does a lot of neurotropics and nutraceuticals, and he eats well. And I said, I was doing really well on one program, and all of a sudden I got off it. 8 months of just nice, clean living was wonderful. Then I got off it, and I did some different things that just messed everything up. But anyway, I said, how are you doing? And he says, Paul, I am so dialed in that I know if I do this, I'm screwed. He said, I have to look at it as it's a matter of life and death.
Yeah.
And he literally, that's what he said to us. So
Yeah.
maybe not on that scale, but when you have an episode like that, you're overheating, you're going out and working hard in 100 degree, but you used to be able to do it all day long.
2 years ago, I could do it. Before the car wreck in 2022, I was out in it
You could do it.
18, 20 hours a day.
Wow.
And I could buck hay with a 19-year-old.
What is bucking hay?
Stacking it, moving it, bales of hay.
All right. I don't think I could lift 36 up. 36.
It's, but it's just a way of life for us. And it's heartbreaking for me because when I go out to try to do something and I can't finish it or I have an issue, I get pissed off because, Jesus, I should be able to do this. This is stupid. And then I get to hating this disease, and then I get down on myself, and then I hate the D word. I don't believe in it. Y'all three know that. Depression. I get in a funk. And then I get pissed off, and then I want to hit people because I get pissed off, and then I want to hit things because I get pissed off, and scream and yell. And I don't know how many times I've scared her assistant because I'll start flooding and he'll go to do something, and I just kind of next thing you know, Samantha's there, and now I'm going, back away.
Yep.
Because what is it, the nerve that causes the fight or flight? Or what is that fight or flight mechanism that y'all talk about?
Welcome to the HeadRush Podcast, brought to you by the Patrick Risha CTE Awareness Foundation. Karen Siegel, thank you so much. Paul?
So go to stopcte.org, learn about their foundation, and they are sponsoring us for the next year. We are thrilled to have them team up with them and bring awareness to this disease.
So please go to their Facebook page, go to their website, check them out. Karen is very, very, very willing to work with you. Contact her, and if you do know her, thank her for us, or just go on their Facebook page and say thank you for sponsoring the HeadRush Podcast.
It's the sympathetic nerve. So we have kind of these sympathetic nerves that run all over our body, and we're trying to find a balance between those, and then the vagus nerve comes in and kind of helps to signal some of the parasympathetic to help balance it out.
And people either have a fight or flight.
Mm-hmm.
I don't have a flight mode.
Right.
Mhm.
My instant is anger.
Mhm.
Mm-hmm.
I think that's one of the things that I know, Kristi and myself have both really dealt with, is that it's very hard because Corey's mentality is, I'm gonna do this.
Yep.
Watch me, and, we really detect the early signs, and sometimes, most of the time when I have a patient, I tell them, okay, we're not doing that today. You're not well. Corey goes, yes, I am. And so next thing I know, he's like, I'm doing all of these exercises today. And if we bargain, it becomes a bargaining match. And so somebody with that kind of mentality, it's very hard to reduce neurological inflammation, teach them how to pick up on early signs of their symptoms and do all of that, because with that, it's honestly a personality that makes you so successful in life.
Right.
And you learn that, early on, because if you work hard and you put in the time and you put in the effort, you win.
Mm-hmm.
Right. And so, to take somebody that's been an athlete for so long and they know how to succeed, and then to tell them now how you succeed is to not, that is so difficult.
Yeah. So when I had 2 strokes in 7 days, and the second one was an ischemic, and it was about 1 centimeter away from where I would have been paralyzed, or left side paralysis and stuff. But when it happened, I couldn't talk.
Your language area, yeah.
Couldn't talk. Could not talk. I'm in the Mayo for 5 days because I had my AFib, and they the speech pathologist, somebody like you, came in, and she would give me 1 page, la, 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 ta, ta. So she'd leave that page. Then she came in the next day, and we got up to ma, ti, la, ti, whatever, right? But I had 5 or 6 pages by the end of that time, and I would read them and speak out loud until I fell asleep.
Yep.
And then I would wake up and I'd grab the papers and I'd read them until I fell asleep. She comes in after the 5 days and she says, Paul, you're the first patient ever. And she said, I've had thousands of patients. Yeah. She says, you're the first one ever to come in and practice and not turn the TV on and just veg out. And I'm like, why would I turn the TV on? I want to figure out how to get better. Now, so somebody like Corey, he wants to get better.
I'm willing it.
You're willing it.
Yeah.
But there's some things that we know, or medically, they're going to inhibit him from taking certain steps. How, I guess the struggle is, how do you how do you get that across and say, hey, it's okay to be.
Exactly. It's okay to take a break. I always tell my patients, you don't push through a brain injury.
You don't push
through a brain injury. You learn the strategies. You learn to listen to your body. You listen to your spouse or your significant other who will help you find out when you are struggling, and then you learn to listen and then to slow down, take a break, and then maybe come back to it at a later time, but you don't push through. Pushing through usually is not the best solution in those situations.
So I've been coming here for 6 or 7 months, right? And so obviously I've got to see he and Susan, and once in a while, not often, but he's gotten a little heated, and Susan was able to redirect him and And you are, so you do have the cognitive ability to listen or hear. But sometimes that, you know, we were talking about the rage. I started going rage in the mid 40s, and I didn't care. You know, it was another level of rage.
Yeah.
Mad, angry, used to be, pull it back in. Oh, okay, daddy's okay now. Rage, lost my mind. Didn't even, but I started talking to Chris Newinski, who knew about CTE, and started learning about it.
Yeah.
So I guess cognitively, I'm saying you have the cognitive ability to look at Susan, and she just said, cool it, or she just gave a buzzword or something like that.
Those are things we worked on, our strategies to help in those moments.
And my wife has perfected it.
Yes.
But again, even before my accident, if I've lost my anger, I remember one time I was racing and a guy slammed into me 3 times going around the track. And this is when we were modified dirt car racing. And I got out of my car, done. This guy's getting buried. I'm going to go just beat him. And I hopped out of that car and I just started taking off for him. And my wife yelled across the parking lot and said, "One more step, we're getting divorced." And it was like, she's the only one, and you can't ask my mom or father anymore. They passed. You could ask Carol. She's the only one in my whole life that has been able to stop me at that point.
And that's why family education is so important, because you're not supposed to go through this alone. You need that support. You need that social support.
Well, that's true.
Absolutely. And being around other people that are going through it, hence the support groups, and just knowing that you're not alone.
That's great. You probably see that on a lot of people,
Absolutely.
a lot of families, a lot of people that are dealing with that.
If someone had to deal with this by themselves, they couldn't do it. And I'm talking as a very strong-willed man. Without my wife, I would not be alive. Back in 2022, for the next year, it was day to day if I was going to live another day. And so, through the grace of God and my wife, and now through the grace of God, my wife and my medical team, and you, because you've talked to me, I've got a team that I surround myself with now, that I know that this too shall pass. I can get through this and get on to the next day. Today's going to suck right now, sucks. Literally right now, sucks. I think y'all know it. But this too shall pass. Tomorrow will be another day. It may suck, but it may be better than today.
Absolutely.
So I had a friend who I played with, and the last 10 years of his life, he started acting a fool. And he knew something was wrong. And he went to his wife and said, "There's something wrong." They all knew there was something wrong, but he was doing things that he should have been kicked out of the house for, and he was kicked out of the house for. And he died by himself in a trailer. And when
takes a strong woman.
Yeah, and she did. It takes understanding, and it takes awareness, because until I saw quiet explosions, I saw concussed 3.5 years ago, and I'm like, oh wow, there's Mike Webster shocking himself with the freaking battery things. Wow, is that what was in store for me? And then I saw quiet explosions, and I said, oh, maybe there's hope. So it's almost like, and I think you're in a position where you got a strong family advocate, Susan,
Mm-hmm.
and you got some great help and some great doctors surrounding you. And these doctors, there's very few doctors there's a lot of doctors that say, I think, that they would give you the time, and if you were hurting, they would definitely see you. But there's not a lot they would say it, but there's not a lot of doctors that would do it. And you're talking about seeing Samantha from 6 to 8 on a Wednesday night or a Tuesday night, or talking to Dr. Kaytser at 9 o'clock, and him prescribing, talking to Kristi, whatever. So you have a great support system.
Right. And I know because of my wife, my support system will be there for me.
Mm-hmm.
Because it was like when we called the neurologist, my wife told me later, I think it was the next day, the day after, maybe we talked about it yesterday, I don't know. And I was going through my neck issue, is that you were there.
I was there.
Called the on-call number for your office.
Mm-hmm.
Well, is this an emergency with us? Tell him it's Corey. Period. Just tell him it's Corey. And she would start asking, just tell him it's Corey. Next thing you know, you called. So I have a strong foundation with Samantha, Kristi, and Kaytser. And even though the on-call person is like, well, we really don't like to bug our physicians unless it's a dire emergency. Is he dying? No. Tell him it's Corey. And then he called. I mean, that shows something about your doctor.
Oh, yeah.
That it's not an emergency. He's been on our podcast 4 times now. Samantha has done wonders for me ever since I started seeing her. And she's so opened my eyes to so much, and my wife's eyes. And Kristi, there's not enough good you can say about Kristi, because she got me in my darkest hour.
Yeah, I did.
When shit was just there.
You know what we did, Corey? We found something to look forward to, which
You
was
know
your
what that
daughter's
was?
wedding. It was your daughter's wedding. We had to find something to wake up the next day for and plan for, and we put together your speech that you did, and we worked on perfecting, we worked on practicing, we worked on giving you the tools so that you could walk your daughter down the aisle.
And it happened. And what did I tell you the next day? Well, at the wedding.
You're asking me
I got to find
remember
a new purpose.
Oh,
Yes.
exactly.
And now you have a
did.
podcast.
Well, and it was the podcast when you were.
That was that was in the beginning stages.
And so it's, so for people like these 3, if you're in the Fort Worth area and you suffer from these conditions, if you don't reach out to these 3, you're an idiot.
Still no filter.
No filter. We didn't meet that goal.
If you want to play the mind games and see doctors that want to hem-haw and BS around a topic, go see them. If you want to see people that will deal with your vestibular, deal with your speech, deal with your cognitive, deal with your neurology, see these 3.
Well, you got
If you don't, well, then I'll see you when I see you.
You're talking not only to the patient, but you're talking to the caregiver.
Absolutely.
Right.
Because the caregiver has to be aware. There's different understandings, different levels of competence, different levels of empathy and sympathy, and there's different levels of service too.
And I think the great thing is Kaytser took away and told me not to drive. And so my wife is forced to go to all these appointments with me, so she's learning. And so she got an education through being forced to take in me. And no, honey, you're the love of my life. I've given them all a hard time. but she's been there every step of the way.
Mm-hmm.
And so she's educated herself. She's on the support groups for caregivers and everything. So she's very much aware of her situation.
Mm-hmm.
And we're out of time.
We're out of time. We need to end on a word of hope for our listeners. Each one of you, what type of a word of hope could you give our listeners?
I think it's just important to know that there are resources out there. There are treatments that are available. And, if you don't have a support system, we're there to help to start and build that for you.
Samantha?
I mean, yeah, I think that, building a great team is really important. And I think, learning about your disorder and building education and, just really getting out there, there's definitely ways to improve your condition, even though, you may have, like with Corey being diagnosed with CTE, he knows the prognosis of this condition. But
Yes.
oh, sorry, TES, possible CTE.
Yeah.
So with that being said, there's still ways to manage his condition. There's still ways for him to have good days, and get the most out of life.
Kristi?
I would say don't give up. Don't give up. There is hope. And you may have to go through a few different avenues to find it, but there are people out there that understand it and that are willing to help the individuals that are going through it, and then surround yourself with people that also can support you during that time. Find the groups, find the people that can be there. Do not do this alone.
When's your support group?
So we meet the first Saturday of every month in Fort Worth. And it's
Physically or
in person?
Zoom?
Yep, we meet in person. We also have a Zoom option for those that can't be there in person.
How do they get a hold of you?
So I can give you guys my contact information, my email.
We'll have.
My phone
I
number.
mean, for the support group, do you got a
Yeah.
website?
So
We'll
Yeah.
put it. You get us the
I'll give it to you.
information. We'll have.
There you go.
Edit it in. We'll definitely
absolutely.
flash it. I'm proud of you, man. You just crashed, but you didn't burn.
Yeah.
Well,
We'll see if you make it home.
we'll make it home. I'm driving. All right. No, even you did good.
I'm blooded.
I bet you are.
So stay alert.
And stay alive.
Have a good one, guys.
Thank you all.
This podcast is for general information only and does not constitute the practice of medicine. The use of this information and the materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard and delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.